So let's talk about a concept called the therapeutic window. I was looking at somebody's online pharmacology course, and they began with this statement right here. This was the first statement that opened their pharmacology course. So I want you to think about how we open our pharmacology courses on Maui and how this instructor opened their pharmacology course. All drugs are poison, something I completely disagree with. Right? And I strongly urge you not to tell your clinical patients this right here, because this is not really accurate. In the early 1500s, Paracelsus made this comment right here. All drugs are poisons. The benefit depends on the dosage. But the key word here is benefit. So sure, a drug is any substance that interacts with a molecule or protein that plays a regulatory role in living systems, so that would include poisons. However, when we talk about medical pharmacology, we're going to talk about medications. And remember, medications are drugs intended for a therapeutic benefit. All drugs are poisons. The benefit depends on the dosage is how we'll open the therapeutic window lecture. Well, we've talked about the agonist dose response curve. This axis is the dose of the medication. And remember, our medication is intended to have a therapeutic effect. So the therapeutic effect that we get from the medication is measured with this axis right here. If we use no medication, we get no effect. As we add more medication, we get more effect. And eventually, we reach maximum therapeutic effect. Adding more medication does not give us more therapeutic effect. Well, drugs also have toxic effects, unwanted effects. And again, if we have no medication, we have no toxicity. But if we continue to add medication, we eventually get to the point where we have toxic effect. And if we continue to add medication, we'll eventually reach maximum toxic effect. We have the potential to end up with lethality. So notice my therapeutic effect matches the agonist dose response curve, as does my toxic effect match the agonist dose response curve. Notice again, no drug, no therapeutic effect, no toxic effect. At small subclinical doses, notice we get no effect. We get no therapeutic effect, we get no toxic effect. As we add medication dose after that, we can reach maximum therapeutic effect with no toxic effect whatsoever. And this is our ideal drug right here. We can reach a medication dose that gives us maximum therapeutic effect with absolutely no toxic effect. So here we have therapeutic effect with no toxic effect. As we add medication again, notice that we've reached maximal therapeutic effect, so we don't get more therapeutic effect, all we get is toxic effect. So this area of the curve would be the toxic effect. So now we have three areas of the curve. A small enough dosage of medication where we get no effect, no therapeutic effect, no toxic effect. On this part of the curve, we get therapeutic effect with no toxic effect. And then if we add medication after that, we end up in the red part of the curve where we have only toxic effect. Well, this therapeutic effect without toxic effect, we can consider that to be our therapeutic window. And so in between the medication dose where we get no effect and the medication dose where we get toxic effect, in between those two zones is our therapeutic window. So notice we are able to dose this medication to achieve maximum effect with no toxicity. So this is an ideal therapeutic window. So this is the therapeutic window of a safe medication. Unfortunately, many of the drugs that we're going to deal with do not have this ideal, safe therapeutic window. Many of the drugs that we're going to deal with have a narrow therapeutic window. So notice our therapeutic window for this medication is narrower or smaller. Now there's a small difference between the therapeutic dose of the medication and the toxic dose of the medication. So the narrower or smaller the therapeutic window, the more difficult it is to achieve a therapeutic dose without toxicity. So the smaller or narrower the therapeutic window, the more dangerous the medication is. A medication with a narrow or small therapeutic window may not be able to be dosed for maximum therapeutic effect without toxicity. So here is our therapeutic window for this drug where we can achieve therapeutic effect with no toxicity. But with this drug, when we begin to achieve maximum therapeutic effect, we begin to incur toxicity. So this would be a more dangerous drug. Well, some drugs are toxic medications, like certain cancer chemotherapeutic drugs, where we cannot achieve therapeutic effect without toxic effect. And so with this medication, the therapeutic window is essentially closed. Any therapeutic effect involves toxicity. So a safe medication has a wide therapeutic window, meaning the difference between an effective therapeutic dose and a toxic dose is very large, meaning that we can achieve maximum therapeutic effect from the medication with no toxicity. Dangerous medications have a narrow therapeutic window, meaning the difference between an effective therapeutic dose and a toxic dose is small. Maybe we can't achieve maximum therapeutic effect without some toxicity. But toxic medications mean that any therapeutic effect involves toxicity. And when we talk about cancer chemotherapeutic agents, you'll see them sometimes referred to as toxic medications because we cannot achieve therapeutic effect without toxicity.